this, what we consider a very strategic roundtable on the role of the health community on climate change and health. I will be the moderator of the day. My name is Neira, and I am the Director of the Department of Environment, Climate Change and Health. A pleasure to be with you. It will be my role to create this environment where our fantastic panelists and speakers will create the case for the leadership of the global health community, and then proposing some solutions, steps, and hopefully a very strong and strategic alignment after that for our action. Can I please give the floor? Thank you very much. They know that I'm Spanish and I need to move, so thank you very much. I feel much better now. Can I now have the pleasure to give the floor directly to our Director General, Dr. Tedros? Do I need to introduce you, Dr. Tedros, or you can go ahead like that? DG, you have the floor, please.
You should introduce me. By the way, we're in Kofi Annan's house, so I will start by telling you a story. Kofi Annan was speaking, late Kofi Annan, and he was invited to speak. And they said before he spoke, you know, everybody knows Kofi Annan, so we will not introduce him. And then he started speaking. But he said he visited a village somewhere, and then children were running up to him, screaming and shouting and singing with paper in their hand. And then as they approached him, he thought they knew him. And when they got closer to him, he could hear what they were saying. And they were saying, "Morgan Freeman, Morgan Freeman." Then Kofi Annan took the paper and signed what? Morgan Freeman.
So let me clarify that it's Dr. Tedros, Director General of WHO, not a famous actor anywhere.
So please introduce me well, because somebody may call me another person. Thank you. Thank you, Maria. Excellency Secretary John Kerry, Excellency Minister Ahmed Nassim, and Mr. Adnan Amin, Ambassador, Your Excellency Ambassador Katrina Stash, Dr. Hussein Irand, Dr. Vanessa Kerry, Mr. Michel Demare. I think we, and our youth, of course, the most important guest today, representing COP27, Dr. Omnia El-Umrani. Dear colleagues and friends, in 2020, I had the opportunity to visit several nations in the Pacific where the climate change is stealing homes and stealing hope. In Tuvalu, I met a young boy called Falu, who told me that he had been discussing with his friends what they would do if Tuvalu sinks. Some said they would leave Tuvalu, and some had said that they would sink with Tuvalu. Those words disturbed and saddened me, because a child of that age should be having fun with his friends, not worrying about whether he will still have a home when he grows up, whether his home will be sunk or not. But the most pressing reasons for urgent climate action are the impacts not in the future, but right now on health. The climate crisis is a health crisis, fueling outbreaks, contributing to higher rates of non-communicable diseases, and threatening to overwhelm our health workforce and health infrastructure. When I took office for my second term, I identified climate change as a priority for WHO's work to support countries in building healthier societies. WHO has identified key actions to mitigate and build resilience to the climate crisis. First, to promote actions that both reduce carbon emissions and improve health. Second, to build better, more climate resilient and environmentally sustainable health systems. And third, to protect health from the whole range of impacts of climate change. We need renewable energy in healthcare facilities, dedicated funding to the health sector for climate resilience, and increased use of reliable, cheap, and green electricity. At COP26 in Glasgow, we worked with the UK government to launch the first health and climate initiative under a UN FCC presidency. 65 countries have now committed to work towards more climate resilient and low-carbon health systems. And with the UK and the Egyptian COP27 presidency, we launched the Alliance for Transformative Action on Climate and Health. I'm pleased that the United Arab Emirates, as president of COP28, will raise the profile of health even further with the first dedicated health day and the first health and climate ministerial meeting to take place at a COP. Shukran jazilan UAE. I urge the health community, from ministers of health to civil society, international organizations to frontline health workers, not to leave climate change as somebody else's problem. This is our mission too. I thank you, and Maria, back to you.
Thank you. Thank you very much, Dr. Tedros. With your permission now, we will have a set of the scene with a promise, a very short intervention, a very short PowerPoint, but we thought that maybe complementary to what Dr. Tedros just said, put in a little bit what are our priorities from the global health community in terms of climate change and health. Can I have the PowerPoint presentation, please? It's not me, so it's not the one. Hello? IT, can I please have the PowerPoint presentation? I don't see anyone upstairs, by the way. Anyway, so we will delay. I think one of the good things on climate change is that we need to adapt and be flexible. Here is a demonstration. Here we are. We can be flexible and adaptable, and this is the clear message. So we wanted to just describe with you what we think is, as Dr. Tedros repeats very often, a climate crisis is a health crisis. Let's as well discuss the challenges and the solutions. Let me have the next one, please. During the last years, we have been focusing on infectious diseases. You see it in red, in blue there. But while the world, we're looking at the risk, the biggest risk. Look at how climate change has been growing. And in 2022, we have climate action failure, extreme weather, biodiversity as the three crises that we are facing at the moment and requiring all of our attention. Next one, please. Dr. Tedros says this is a global health priority. He insisted now, and we don't need to repeat it. And that is why we need to prepare for that and respond. Can I have the next one, please? For some of you, this might be new, how the climate change and health community has been working, but I wanted to reassure you. I don't know why the PowerPoint is disappearing, but it's probably to demonstrate that we are very flexible. We started more than 30 years ago on the evidence and implementation. The first report you will have there is from 30 years ago. This is the Climate Change and Human Health report that was produced by WHO more than 30 years ago. Then the scientific arguments settled. Since then, we have been providing all of these relevant tools. And of course, we reach it today where many projects are already happening and many of the countries here represented on adaptation and creating this climate resilience that is so much needed. Next one, please. So we wanted to present three grand challenges for the health community today. Next one, please. First challenge is clearly we need to address the wide range of health impacts of climate change. And this challenge is the protection of health from the range of climate impacts. Those climate impacts will come from the different vulnerability factors that you will hear during the presentations different exposure pathways, and represent many risks from injury and mortality from extreme weather events, heat-related illnesses, respiratory illnesses, waterborne, vector-borne, zoonosis, malnutrition, non-communicable diseases, mental health, all of them, but all of them needs to be addressed on a very comprehensive and strategic way, not one by one. The only response is to have a health system with the capacity and resilience to respond to all of those health challenges posed by the climate-sensitive health risk. Next one, please. Let me now move to the second big challenge that we are presenting for the health community, which is how we strengthen the climate resilience and environmental sustainability of the health system and facilities. And this is the way we propose. WHO has been defined and tested an operational framework that is at your disposal, not only defined but tested in many countries here, looking at the building blocks of health systems and how those needs to be addressed in order to become climate resistant at our healthcare facilities and sustainable, low carbon if possible. All of those blocks can be defined, but I will not go into details here. But this frame is at your disposal, will be updated at the end of this month, and I think it can provide the good basis for making sure that we strengthen and we created those climate resilience healthcare facilities. Next one, please. This one means that if you look on the UHT index, of course, we want all the countries to go as high as possible, and the greenhouse emissions from the healthcare will be a second factor. We would like to see all the health systems in this one, but obviously, if you are working in Africa, your health system needs to gain access to universal health coverage, and you don't need to care about your carbon emissions because you don't have. But for other sophisticated hospitals in medium income and high income countries, we need you to reduce these greenhouse gases emissions from healthcare, and then having those healthcare systems that will be both prepared to deliver greater resilience, lower carbon emissions. In a word, or in a sentence, the health systems that fit for the 21st century. Next one, please. So this is the quadruple win. For those countries that they are not contributing to carbon emissions, they still need to have access, gain access to clean sources of energy. And this is what we call the quadruple win. If we do a solar-powered healthcare facilities, we will make sure that the 1 billion people that are still served by healthcare facilities without electricity or with unreliable power supply, they will gain access, and therefore they will be able to perform all the healthcare that is needed, having all their responses from their patients, and not be reliable on very polluting, sometimes diesel, very expensive, and subject to the fuel supply shortages. Today, the renewable energy is gaining momentum, the prices are going down, the logistics are going down as well, and therefore we are prepared to scale up with other panels on a very big solar-powered healthcare facilities. Next one, please. The last one, the third challenge, and this is a positive one, is that not only our health systems they need to be prepared to cope with all of those health challenges, but we can as well gain the health benefits of a low-carbon society, and we need to advocate for that. We are just giving you 3 examples of what that means of gaining the health outcomes of mitigation policies. If we accelerate to clean energy, we will contribute to reduce the 7 million deaths, premature deaths each year caused by air pollution. If we go on the transition for more sustainable food systems, we can reduce the 2.8 million deaths each year from overweight and obesity. And if we go for a healthy, sustainable transport and urban planning, we can reduce 3.2 million deaths per year from physical inactivity and 1.3 million deaths from road traffic crashes. So a fantastic opportunity for public health on all of those health outcomes that can be obtained, for which we need to advocate for more mitigation. Next one, so what do the countries need? Political ambition. we need to first be empowered and as Dr. Tedros was saying, realize that this is our business. This is a health business. And that's why we are very happy that after the COP26 health commitments and with the support of Egypt on COP27, we have now 66 countries, and the number is growing every day, joining ATTACH. ATTACH is the Alliance on Transformative Action on Climate Change and Health. And we have countries, UN agencies, NDBs, NGOs, technical experts, private sector as well. And this is an incredible opportunity to align all of us, our forces, if we use this type of political ambition. Next one. What do the countries need? And this is my last one. They are already going into a number of initiatives on surveillance of climate-sensitive diseases. They are looking at meteorological information. They are putting it together. There are many activities, as you can see, that are already happening, looking at malnutrition, doing vulnerability assessments. So WHO, this global survey on climate and health in 2021, the only thing that is very disturbing is that countries know now what they need to do, most of them, and if not, we have the tools to help them. But when they go to implementation, they cannot implement. And the answer why they cannot implement is there. Insufficient finance budget. 70% of the countries have declared that they don't have the budget they need to prepare the health systems to cope with the massive risk represented by climate change and health. Just on one point that I didn't mention, the health system globally represent 5% of the global carbon emissions, 5%. Obviously, only those medium and high-income countries that are contributing. So we have an opportunity to lead by example and decarbonize the health system and reduce that. So my last slide was just to say thank you very much. And let's cope now with the panel. Let's go back to the panel. Thank you. Okay, back to moderation. Let me, it's a great pleasure now to introduce Dr. Vanessa Kerry. Dr. Vanessa Kerry is the director, the chief executive officer of SEED Global Health, working and with a lot of experience at country level. And she will be followed by Secretary, United States Special Presidential Envoy for Climate, John Kerry. So Vanessa, over to you, please.
Thank you very much, Dr. Neira. And as you just heard from Dr. Neira and also Dr. Tedros, the pace of climate change and its growing impact are really at a tipping point. And nowhere is this more clear than at the intersection of climate and change and health. Our fragile progress is being lost. According to the WHO, where we are, 1 in 4 of the world's deaths today are from preventable environmental causes. Our critically underserved and under-resourced health systems and our health workers cannot deal with the burden of disease today, let alone the burden exacerbated by climate change tomorrow. Yet, this dire picture can actually be one of optimism, because before us lies a choice, a pathway to create a cascade of benefits to protect our planet, our livelihoods, our health, wealth, and well-being. If we embrace a health-centered response to climate change, with smarter investment, we can have catalytic impact across multiple sectors. Together, we can create extraordinary and collective gains if we stop operating in silos. Investments in reducing air pollution, which causes 7 million deaths per year, more than we saw officially recorded globally in the entire COVID pandemic, will prevent a future loss of almost 50 trillion we've spent since 2010 to address this impact. Investments in green energy for health systems will decrease our carbon contribution and ensure stable access to medicine, oxygen, blood, and services for those most vulnerable, for our patients, my patients. Investing in strong, responsive, resilient health systems and the health workers that enable them, which is near and dear to my heart because I am one, will allow us to address both the coming flood of disease from climate change, as well as the existing pandemics of HIV, TB, malaria, maternal mortality, and NCDs that we are already fighting today. In the organization which I lead, Seed Global Health, we have already seen this impact on the ground in the countries where we work. Our critical mission to train frontline health workers is becoming even more urgent. In Malawi, in deep partnership with the government, we are helping to tackle the worst outbreak of cholera in the country's history, driven by ferocious storms accelerated by climate change. And when Cyclone Freddy took out the bridges to essential birthing units, we helped provide additional services to existing units so that women could deliver safely when they couldn't reach those. These investments will help grow GDPs, reduce migration, and even our CO2 footprint as healthier people seek less services and use less energy and resources. The news of a first ever Day of Health at COP28 is welcome, but only if accompanied by a commitment to end a pandemic of expedient and poor choices. Health must be mainstreamed into the debate and championed by leaders from local communities to the G7. What does this look like? First, health must be included in the cover decision, in the global stocktake, and in the metrics that we measure. Second, we need a multi-sectoral consensus to mobilize unprecedented levels of smart financing for health and to identify win-win investments in health through current climate financing mechanisms, which prioritize health, equity, alongside mitigation and adaptation. Today, only 2% of adaptation funding and 0.5% of overall funding for climate change is allocated to health. Third, we must move from community engagement to true investment in community leadership. Communities have lived experiences that are not siloed. Communities respond in ways that are interconnected, integrated, and transformative to their needs. Our collective global community must respond in the same way. Our painful truth is that a decision to invest in our health and well-being through climate change cannot be deferred. I say this as a mother of 2 children, but also as a daughter of a tireless optimist. I was raised by parents who instilled in me a deep belief in the power of service and of sacrifices made in the determined fight for this planet and our relationship to it. I have been taught the power of hope, the strength of diversity and differences, that there is always a solution to be found, and to pursue relentlessly what is right and what is just. In the most quiet of moments, I have been reminded to never turn your back on someone in need. The fight for our better future, whether through stronger health systems or a greener climate, are interlinked and span generations. It is my legacy, it is my children's legacy, and it needs to be our collective legacy. Because right now, we are fighting for our collective need and survival, for our health and well-being, for our one Earth, and for our global community. So I am delighted to welcome my father, who also happens to be the U.S. Presidential Special Envoy on Climate Change, John Kerry.
Well, good morning
there,
to
Dad?
all of you, or I guess early afternoon. And Vanessa, thank you so much for not just what you're doing. Thank you for those
Dad,
really
we can't
generous
hear
and
you.
moving comments. Can you hear me?
Oh, and these is in the earphones. Good to know. Thank you.
Can you all hear me?
Now we can.
Hello? Can you hear me?
Yes, we can hear you.
Thank you so
Secretary.
much.
Thank
I
you.
apologize. Ness, let me just say how proud I am of what you are doing and the work you're doing, which is phenomenal. And I just confess to everybody that I really didn't think enough about the link between climate and health until Vanessa started making the science-based arguments pretty obvious to me, and really talked about global health in a larger context in view of what is happening to the climate of the planet. And Vanessa, I thank you for what you were doing, and I thank you for that educational effort with your dad. Thanks for making that connection, and I'm grateful and blessed for it. Also want to thank Dr. Tedros, alias Morgan Freeman. Great to be with you again, Dr. Tedros. You and I began when I was Secretary of State, and I've enjoyed watching the extraordinary battle that you've been involved in on behalf of the WHO and everybody in the world. And Dr. Neira, thank you for your efforts, and the entire WHO community. I'm so grateful for what you do, and I know what a bitter period it has been with COVID and how many unfair attacks were leveled. That seems to be the price of public service today. But we are all deeply grateful to you for what you did over the last few years. And equally importantly, for sounding the alarm about the climate crisis. So thank you, not just for this event and what you're doing, but thank you for being warriors in this battle. And make no mistake, folks, it is a battle. I've been involved in public life for more than 50 years now, going back to a war in Vietnam, and in the Senate for 28 years, and Secretary of State, now Special Presidential Envoy. And I've never seen people so willing to wrap their arms around ignorance and a certain kind of arrogance and avoid facts and be unwilling to do what the facts are screaming at us to do. And that's what brings us all here today and to the work that you do every single day. I am one of the few people on this program without a background in health, other than trying hard to live healthily. But there's really no polite way to put it. The climate crisis is killing people. It is knowingly, wittingly allowing people to die and infecting them with disease and providing them with air that kills people, because we're not willing to take the steps necessary to do what we know we need to do. And what people have been screaming about for 30 years, 35 years plus now. Many of us were in Rio. I was there in 1988 when Jim Hansen first testified to us about what is happening. And every year now, millions of people around this planet are dying because fossil fuel and methane emissions, called greenhouse gas pollution, not just gas, pollution. And we used to care about pollution. We used to apply a polluter pays principle to the concept of pollution. But now those methane emissions and CO2 emissions and nitrous oxide and other emissions are escaping into the atmosphere, being fed by the way in which we continue to choose to fuel our vehicles, propel our vehicles, heat our homes, light our factories, and so forth. Those emissions result in disgraceful polluted air quality, extreme heat, loss of water, loss of crops, loss of ecosystems, and at every stage, the loss of life. And the truth is that responsible people, particularly economists and people who make enormous decisions about trillions of dollars and its allocation to the building of capital and investment around the world, ignore the real cost of what we're choosing to do. The cost of coal is not the cost of mine to burning. It's the cost of black lung disease. It's the cost of increases in the problems of emphysema, of heart disease, of all the other downstream causes. And the ash that is filling up lakes and rivers and denying people the right to fish or swim in various places. The warming of the ocean, 90% of the heat on the planet goes into the ocean. And that heat is changing the chemistry of the ocean, and it is warming the ocean in dangerous ways, as we're witnessing, not the least of which is the possible tipping point we may have reached with respect to the Arctic and the Antarctic and the coral reefs and the Barents Sea. And of course, permafrost, which is thawing around the world, which releases massive amounts of methane. So the choice really is fairly obvious. And if the consequences of what I've just described don't underscore a health crisis, I don't know what will. So when President Biden or I say this is the decisive decade for action, that is not two political people speaking. That's not a liberal or a conservative or a Democrat or a Republican speaking. Those are people who have listened to the facts that you and others have helped to put on the table. And what adds insult to injury, surely, for everyone, is that everything we're talking about that are the consequences of this crisis are preventable. All preventable. I'm glad to say that many nations have made the decision to do more. 20 nations equals 76% of all of the emissions on the planet. And we are now on a course to reduce our emissions by the scientifically arrived at goal of trying to have a 45% reduction by 2030, excuse me. And our goal is actually 50 to 52% reduction. And we're quite convinced that we'll be able to get there. But we have a lot of other countries in the world that continue to build coal-fired power plants and continue to burn that coal-fired power. So President Biden has developed a program called PREPARE. It's the President's Emergency Response Plan for Adaptation and Resilience. It is now helping more than 500 million people in developing countries to manage the impacts of the climate crisis. And just last month, President Biden announced at the Major Economies Forum, that is the 20 largest economies of the world, that we're going to immediately put $1 billion into the Green Climate Fund. And we are working on releasing tens of billions, hundreds of billions from the private sector by bringing them to the table and creating blended finance mechanisms and other ways of investing these critical funds in the solution. As Vanessa eloquently pointed out, lives are not just going to be lost in the future. We're losing many more lives every year than we lost in the Holocaust and World War II. Maybe 3 to 4 times as many lives now. Extreme heat is now increasing around the world. There are millions of people who are sleeping outdoors in India right now because they can't find relief. And even at nighttime, it's 30 degrees centigrade in the air temperature. So we have our work cut out for us, folks. But here's the good thing. And I just close on this point to all of you. We have to be led by common sense. And if there's a threat which we see to our health, we ought to, as public people, demand that our governments and the private sector are going to respond appropriately. This finance gap that we face is really the greatest stumbling block of all right now. Well, maybe of all. We also have to fight back, and you all can provide the testimonials of impact. We have to fight back against the greed and the sort of willful blindness that people adopt to the reality of where we find ourselves. There is barely a space on this planet where there is genuine sustainability. And where you find it, you will almost always find indigenous peoples who are managing that land and their air in a more responsible way. Most of the planet is made up of indigenous areas of land that have been guarded for centuries by people who apply a different ethic to their daily living. So, my friends, we can win this battle. We came out of Glasgow and Sharm el-Sheikh with the IEA telling us that if we did everything that was promised, we would actually hold the Earth's temperature increase to 1.8 degrees out of Glasgow, 1.7 degrees out of Sharm el-Sheikh. And if we do what is necessary in Dubai in December, we could perhaps get close to the 1.5 degrees. It is doable. It's hard. It's really hard. And it's being made harder by the day by all of this new, gas and oil and fossil fuel burning that is taking place despite the realities that we face. But we can change this. I know this. I've seen that kind of change happen previously, and we have now got more venture capital money moving into green hydrogen, battery storage, direct air carbon capture, storage and utilization, the possibilities of new energy coming from sources that we've never been able to tap, like fusion, small modular nuclear reactors. Things are happening. And you all, each and every one of you, can frankly provide the best testimonials of all to move public people to take the action that we need, because you can tell the stories of real people and of the suffering that takes place because we refuse to make the most obvious choices. So thank you for gathering to consider this connection of climate and health. It is the connection. Climate is a matter of health, and health is always going to be impacted by what happens to our climate. So please continue on the front lines. Thank you for your advocacy. Thank you for your service. Thank you for what you do for humankind. Let's win this battle.
Thank you very much, Dr. Kerry, Secretary Kerry, for this fantastic and powerful intergenerational dialogue and for reminding us that health can be the most powerful argument to win this battle. It is now my pleasure, since we are talking about the future, about engagement and the importance of health in the climate change negotiation, it is now a great pleasure to give the floor to Mr. Adnan Amin. He is, in addition, a good friend, the CEO of COP28, and he will tell us the good news and how we are positioning health in the COP28. Mr. Adnan, over to you, please.
Thank you very much, Maria, Director General, Excellencies, ladies and gentlemen. Truly is a pleasure, but it is a very difficult thing to do, to speak after the entire Kerry family, because of their ability to raise the critical issues of the day and to address them with passion and to inject a spirit of public service. I've had the challenge of speaking after John Kerry several times, but when you add Vanessa to the picture, it just becomes too difficult to do it. So let me start by, on behalf of Dr. Sultan Jaber, the incoming president of COP28, to start by congratulating Dr. Tedros and his team on elevating the political profile of climate change at the World Health Assembly this year. It's been a long time coming, and I think one of the lacuna that we have seen over the years is that we have had tangential discussions around health, knowing the severe impacts on human health that are associated with climate change trends, but we have not put health at the center of the climate discussion. For us, coming into COP28 at this point, we are determined to do that, and I'll outline the ways in which we can do that. But let me say, first of all, what an important juncture it is for COP28 this year. It's a very significant COP, not just because it's being held in the UAE, but because it is the first ever global stocktake, the first stocktake since the Paris Agreement, the stocktake that will give us a sense of where we are on the achievement of the Paris ambition, the 1.5 target, and across all the Paris targets from mitigation, adaptation, and finance. And with the recent IPCC report, we have had very troubling news where there is a scientific consensus that we are way off track on meeting virtually every goal of the Paris Agreement. If we are to course correct, if we are to meet the ambition that John Kerry laid out of meeting the Paris Agreement's ambition, we are going to have a massive course correction, and that course correction needs to happen at COP28. We will need to decarbonize, we will need to reduce mitigations by 43% by 2030. This is the decade of action. This is the critical decade during which we can bend the arc of emissions, and this is the decade during which we have to put in place the critical elements we need for a strategy on adaptation for the future. And this is the COP where we need to re-establish global solidarity to support the most vulnerable countries and the developing countries to be able to deal with the implications of a crisis that they have not caused. And it's as big as that, the lift that we have at COP28. The challenge is immense. We've come through a process of various COPs that have been, incremental in terms of outcomes. We have had incremental outcomes on mitigation, on adaptation. We need a transformative outcome at COP28, which means that the agenda for COP28 has to be inclusive. It has to go to the critical issues that we need to address to change. It goes to the heart of mitigation and transition in the energy space. We need to transition our energy systems rapidly to low-carbon energy systems. We need to put in place the ability to adapt to some of the critical trends that we're seeing. For example, one of the areas that we will be focusing on is food security and food systems. What has become very obvious in the last few years with the drought that we see, for example, we've had 5 years of recurrent drought in the Horn of Africa, which has led to very serious human repercussions, which has led to movements of people, which has led to conflict and strife. We are seeing the specter of that in more and more parts of the world. Our food systems are under stress, and our ability to address food insecurity, which drives potential conflict, is limited. We need to have a fundamental transition of our food systems. And then health. I think one of the greatest lessons, and I fully associated myself with John Kerry's remarks to you, Dr. Tedros, about the role that WHO played in the pandemic. But the pandemic showed us a very important lesson, which is when we are faced with major health events, and all of you are far more aware of this than me, when we are faced with major health events that have global ramifications, we are very, very far from being prepared to meet with them. We saw the stress that public health systems came under, many collapsing. We saw the absence of global solidarity in terms of sharing technologies, vaccines, other equipment. And we saw that so many people who were exposed to this at low cost could have been helped to be able to deal with the crisis that we faced. And if you look at the climate change trends that we are seeing today, changes in disease vectors. I had many meetings with ministers and officials yesterday and earlier today about what's actually happening with health. We're seeing, for example, disease vectors like malaria now making an appearance in Southern Europe and spreading further. I was living in New York when the Zika virus became very obvious that it has penetrated up to the northeast seaboard of the United States. We're seeing diseases that we thought that we had controlled, like yellow fever and dengue fever, recurring in places with an intensity we had never expected. And we're seeing our institutional capacity to deal with those shrinking. And as the impacts of climate change mount, and as the challenge to our straining health systems mounts, we need to be prepared to deal with this, and we need to be prepared to put in place the arrangements where the international community, acting in an act of global solidarity, but also in an act of self-preservation, comes together to design the strategy for how we're going to take this forward. I was really struck by one sentence that Vanessa used, which I wrote down. Said, "We have also experienced a pandemic of expedient and convenient choices. A pandemic of not making decisions. We need to now move into a decision framework for health and for climate that begins to bring us back into a safe environment for the population of the world." At COP28, we intend to have the first ever health day to take place at a COP. There will be an entire day devoted to health issues, from finance to technology. There are so many potential solutions on the table. We need to bring all the constituencies together to start to address what are the solutions. This COP must be a COP of solutions, not a COP of wishful thinking, but a COP of solutions. We need to make it a COP of action. So in addition to the Action Day on Health, we will have for the first time, in collaboration with you, sir, Director General, the first ever health ministerial will take place at COP28, where we will discuss in operational terms the intersection between health and climate and what the role of health ministries and the political commitment that health ministries need to bring to the table, and how we will mobilize the financing and the political will around the solutions we identify at COP28. That's, for us, the critical issue for health and climate. So we want to make this an inclusive COP. We want to make this a COP of solidarity. We need everybody at the table. I had an excellent discussion with Her Excellency, Minister of Health of Brazil yesterday morning, talking exactly about the role of the indigenous people in this discussion, the reason for inclusion of marginalized communities. Why do we need them at the table? Is because we need a joined-up system of action that finally takes us to a position of global security and prosperity built on an investment case for climate action that provides a positive future. That's the vision that we have for COP28. I know that work started in Glasgow on the ATTACH program. Many countries have joined that program. We really appreciate the work that was done in Glasgow and subsequently in Sharm el-Sheikh, and we want to build on that, and we want to give that more substance and more direction and more force in terms of its outcomes. So I welcome you all. Please participate in this discussion. Please be part of this broader outreach of how we really begin to systemically address the health issues that we are facing in the context of climate change. Be with us at COP28 and come with a solution mindset. Many of you are owners of solutions. If we just didn't have the avenue to advance those solutions, and what we are offering at COP28 is that avenue. I'm very honored to have with me Dr. Hussein Al-Rand from the Ministry of Health of the United Arab Emirates, and with your permission, moderator Dr. Hussein will also say some words. Thank you very much.
It is an honor to be with you here today. First, I would like to commend Dr. Tedros and WHO teams on their leadership and continued effort to raise the political visibility of climate health nexus. The United Arab Emirates is honored to be part of the first ever strategic dialogue on health and climate change at the World Health Assembly. We must break down silos and work across sectors and ministries to build climate resilient. To this end, the Ministry of Health and Prevention has been working very closely with the Ministry of Climate Change and Environment and COP28 Presidency. We are coordinated engagement with all entities within United Arab Emirates and working hand in hand with our counterparts from all levels of the government to support them in strengthening climate resilience. Given the high and growing vulnerabilities to impact of climate change, the United Arab Emirates signed up to the ATTACH initiative and have committed to transforming our health system to be climate resilient and low carbon. We are particularly focused on strengthening our response to heat stress and extreme weather events. We are grateful to the support of our WHO colleagues and have been working closely with WHO EMRO to conduct the United Arab Emirates Vulnerabilities and Adaptation Assessment and develop Health National Adaptation Plan. We are keen to continue working with WHO, the COP28 Presidency, and our counterpart from other ministries to progress on this front. COP28 will be the first COP to have Health Day, and the first COP to host a climate and health ministerial. On behalf of United Arab Emirates, it is an honor to invite the ministers and government present here today to the ministerial at COP28. We also extend an invitation to work with us to co-design the agenda for ministerial meeting and define what success looks like for all of us collectively. We hope that we can use the Health Day and Climate and Health Ministerial to highlight some of the best practices and advancement made by member state and non-state actors. We hope you will support us in leading the way on translating commitment into concrete action. Through our collective commitment to address the risk of climate change, I am confident we can mobilize global action to strengthen the climate resilience of the health system. Thank you all for giving me the floor and look forward to welcome you all in Dubai, United Arab Emirates at the Health Day. Thank you.
Thank you. Thank you very much, Mr. Amin. Thank you very much, Undersecretary Minister of Health, for this unprecedented Health Day. Be reassured that we are going to take this Health Day and the ministerial and make it as positive as possible and as impactful as possible. You are giving us an incredible opportunity. We are not going to miss it, for sure. We have an incredible program in front of us, and I've been a horrible moderator because we are already late. One of the things you need to consider when you talk about climate change is the vulnerability. Some countries, some populations are much more vulnerable than others. That's why it's my pleasure to give the floor to Mr. Ahmed Nassim, the Minister of Health of the Republic of Maldives, and I'm sure that he will bring the voice of the 6 countries, one of the most vulnerable ones. Please, over to you, Minister.
Thank you. Thank you very much. Dr. Tedros, distinguished members of the panel, fellow ministers, dignitaries, and friends, all of us in this room, we are all advocates of health and well-being. This is why we are here today. The WHO is founded on a recognition of the interconnectedness of the diverse people of the world. We live in different landscapes, use different ingredients, and have different kinds of animals as pets. But we are an interdependent global community. We have many more things that unite us: football, Facebook, the ocean, and many things that we are working together on. We also know, especially in light of all the work that we have been doing the last few years, that when we act together, we can take concerted and impactful action. Thank you all for being and filling this huge conference room. Thank you. Thank you for coming. I'm going to talk today about one important issue that's really bothering us. That's the issue of microplastics. As microplastic pollution is an issue that affects our health across the globe. Because if we follow the science, it is a crisis that demands urgent, very urgent action. Since Leo Baekeland invented bakelite in 1907, researchers have been creating new and more effective synthetic polymers. But it has only been about 70 years since plastics have been mass-produced and distributed across the world. Earlier this year, some of our Maldivian explorers found plastic waste all the way down as deep as 1,000 meters below our reef flats, sea bottom. Recent studies conducted on our beaches and waters show some of the highest levels of microplastic pollution in the world. Researchers find plastic in the atmosphere and ice in the remotest regions of Antarctica. In fact, the extent of plastic in the world is so pervasive that some historians and scientists have started considering plastic as one of the key indicators of our historical epoch. They call it plasticine. In a few tens of thousands of years, archaeologists will be able to identify our period by the plastic that they will find in our particular layer of ocean sediments or ice or rock as stratigraphic markers in archaeology. Plastics are hardy and some of them don't disintegrate, so they could become recycled fossils. So what are microplastics and how do they get everywhere? Microplastics are defined as plastic particles that are smaller than 5 millimeters. And this includes so-called nanoplastic particles as well. Recent research looking into these tiny particles has proven that plastics have entered our bloodstreams and our organs and tissues. How has the plastic become so pervasive? That it is in our blood. Microplastic don't disintegrate, and they are found in all shapes and forms, from thin films that float in our winds to hard pebbles that get polished by the waves on our shores. Plastic is in our food and water, in wildlife, in the water that the fish we swim in, and in the air we breathe. Researchers have discovered that one of the widespread sources of microplastic is dust from tires abrading on our roads. A lot of this dust ends up in the ocean, and from there it evaporates into our atmosphere, traveling with the wind all the way to places like Antarctica and high mountain peaks. The health of our communities, especially in small island states like ours, are deeply intertwined with the health of our reefs and ocean. The climate crisis demands that we work together to help each other become more resilient. As rapid changes to our environment disrupts our lives, our resilience will determine our survival. The extent of the effect of impact of these pollutants on human health is still being actively researched, and much remains to be discovered about the extent and nature of their impact on our environment. In our everyday lives, we use plastics of different textures and consistency appropriate for the many different objects we use it in. Materials researchers use different chemicals to produce these different varieties of synthetic polymers. Some of these have been found to contain chemicals that have leached into the environment. There are not enough studies to know exactly the nature and extent of the effect of this, but we know they may be interfering with organ functioning and cell regeneration, creating a host of problems. There are increasing cancers in younger people, increased in intestinal intolerance, problems with breathing, fertility, and the list goes on. It is clear that the pervasive microplastic pollution is linked to health issues, and that we need more research to root out the extent of the crisis. Science can give us solutions and help us develop appropriate strategies and methods so that we can begin to tackle this on a global scale. In 1995, the Nobel Prize for Chemistry was awarded to F. Sherwood Rowland and Mario J. Molina from California, and the Swede Paul J. Crutzen for their research into the properties and effects of CFCs and their effect on the ozone layer all the way up in the stratosphere. Ozone protects life on the surface of the Earth from harmful radiation from the sun, and its depletion causes worldwide health impacts. You see, CFCs are volatile chemicals that once released from the aerosols and refrigeration units went everywhere, reacting with ozone and depleting the amount of ozone in our atmosphere. Their research was the foundation on which the world took concerted action. Some of us here will remember it. Today, scientists have demonstrated that our ozone layer is slowly healing and replenishing itself. And if the trend continues, we could be back to pre-1980s ozone levels in most parts of the world by the 2040s. It will take more than 20 years more to replenish in Antarctica. I take a lot of hope from this positive result, good old Earth, even though it took well more than a decade after their research for concerted global action on the issue. In the 1970s, when these scientists were doing their research, CFCs were being used worldwide. The production of CFCs was nearly 1 million tons a year, representing roughly $500 million for the chemical industries. As you can imagine, there were many challenges to their findings, and the going was slow. But the ozone crisis was the first time that the world recognize that the things we do can have planetary scale impacts. But we live in a very different world now. We are now recognized, we all now recognize the planetary impacts of our habits and ways of life. We are now ready to respond to global challenges. We recognize that to bring worldwide change, we cannot rely solely on the actions of a few individuals. It must involve everyone, and we must find our way together. By providing alternate solutions to plastic consumption, we create a generation that is not reliant on plastics. The younger generations already display a growing awareness as conscious consumers, and it is our duty to nurture this inclination. By listening to them and encouraging their love for the environment, we empower them to become agents of change. Through education, it is our duty to equip them with the tools needed to continue creating impactful change together. In closing, I express my gratitude to the World Health Organization for organizing this meeting here and allowing me to address on this microplastic issue, which is of deep concern to the Maldives and the children that are living in Maldives.
Thank you, Minister.
Thank you very much.
Thank you very much. We'll do a little change in the program. It will be now. Thank you so much, Minister of Health Maldives, for this very important issue on the microplastics. We are definitely very much convinced about that. It will be now my pleasure to give the floor. And again, I will ask everybody to please respect the time because we will never gonna make it. Dear Ambassador Katerina Stasch, the permanent representative of the mission of the Federal Republic of Germany to the United Nations. Thank you. You have the floor, please.
Thank you very much. And yes, climate change and health is really high in the German agenda. And just one thing to illustrate this is that we have a fantastic health minister, Karl Lauterbach, who's a medical doctor himself and a professor of health. And before he came into office, he wrote a book. And he wrote a book on climate change and health. And now he's our minister. So that's really great. Now, Maria asked me to talk about what can member states do, what can we all do to support the climate change or the climate and health agenda. Well, I would say there's many things we can all do. And the first thing is we need to raise awareness. We need to raise awareness first with the people. And I know that there are many wonderful people here in the room who do exactly that, to raise awareness. What does it mean? What are the effects of climate change to health? Second, we need to raise awareness with our governments. And I guess that's why we're here for today. And it's wonderful to see a room full of you here today. Third, we need to raise awareness within international organizations. And thank you very much, Dr. Tedros and WHO, for doing exactly this. And of course, we also need to raise awareness in what I would call the climate community. And so it's really great that you will introduce an entire day and dedicate an entire day on the climate change and health agenda at the next COP. I think this is really great. Now, there are also a few things we can do here in Geneva. And you have mentioned it. We are engaged in the Attach network here, and I come back to that later. And also, we have a group of friends on global health, and we dedicated the last events within this group on the very topic of climate change and health. And I know Omnia has been there and Dr. Tedros as well, so it's great to see you today in real life. So, first, raise awareness. Second, of course, take action. And we know from our work in Attach that there are two main challenges when it comes to taking action. And the first one is, and I think it has been mentioned before, the first thing is the access to funding. And we know that especially the countries that are most affected by the impacts of climate change need fast and simple access to funding. And now here comes a piece of good news. A couple of days, maybe weeks ago, Chancellor Scholz has announced that Germany will provide an additional 2 billion euros to the Green Climate Fund. And I think this is really good news already. And we, of course, hope that many governments will follow. We also need to make sure that the low and income middle countries can access this funding. And we need to improve the technical guidance. We need to improve the technical guidance for submitting successful proposals, and we need to reduce the bureaucratic thresholds. And I think this is one of the main challenges ahead of us. Second, we identified that there is a missing intersection between climate and health. So there's funding for climate and there's funding for health, but we need to bring this together. And I was quite shocked to read one of the numbers, and this is only 3% of the global climate financing is going into health. So in a way, there's a huge potential. And for this reason, it is super important that we do link the funding for action on climate and health, and that we break down the silos between those two. And this is exactly the reason why Attach was founded. And this is exactly the reason why the work in Attach is super important. And this is very concrete. This is action. And we, as Germany, are currently the co-chair of one of the Attach working groups. And this is the one on accessing finance for climate and health objectives together with the World Bank. And this working group, again, this is very, very concrete, provides a central platform for making resources to support climate-resilient health systems and sustainable development and make it more accessible. And the next discussion in this working group will be in September, so right before the COP, and we hope we can actually put some concrete proposals on the table at COP. Now, these were just a few examples how we can actually engage, how we can support the climate and health agenda. And to conclude, let me just repeat, go home and raise awareness with the people, with the governments, within the international organizations, and within the climate, what I call the climate community, and take action. Thank you.
Thank you very much. Two words we need to retain. One is the 2 billions. I'm sure that everybody retained that. And the other one is Attach, the word of the day. So please make sure that everybody knows before leaving the room what Attach is, and make sure that you are already a member of Attach. Okay, thank you so much, Ambassador. There are no negotiations, discussions these days without the participation of the youth. So I'm very, very pleased to give the floor to Dr. Omnia. She is a medical doctor, but is as well the first young representative of the COP, and we thank as well Egypt for that. And I would like as well to recognize the participation here of YUMGO and the council, the Youth Council of WHO. Can you please stand, those young people? Please, come on. Thank you. I'm afraid that means that the rest of us, we are not classifying for that group. Anyway, so Omnia, please, you have the floor. And respect the timing. I'm sure you will do it.
I will. Your Excellencies, distinguished guests, I'd like first to thank you for the opportunity to bring in the perspectives of young healthcare professionals to this very important roundtable. It was only 6 months ago when my country, Egypt, hosted the UN Climate Change Conference in Sharm el-Sheikh. And I was lucky to be appointed by the COP28 President as a young medical doctor who herself saw the detrimental impacts of climate change on her patients and generation as the first official youth envoy. 1.8 billion young people, including children and adolescents, are now shouldering the impacts of climate change on their lives and livelihoods. Almost 1/3 of deaths of children under the age of 5 is directly linked to environmental degradation. 1 out of 5 children lack access to safe drinking water, while air pollution affects young people the hardest. This is also combined with the exacerbation of the inequalities in access to healthcare services, education, and decent job opportunities, especially for young women and girls who make up 90% of the climate migrant population, and also experience gender-based discrimination and violence that is aggravated by the scarcity of resources. Climate change is also affecting the mental health of young people, from despair at the unpredictable climate disasters to the anxiety about the future of mankind. These feelings are further heightened by the disconnect between young people and their governments and public institutions. Yet, I'm not here to tell the story of my generation's distress, distrust, and disappointment. I'm here to share that young people around the world are leading the climate challenge. They are doing this with innovation, with dedication, and most importantly, with a powerful health argument that climate action is going to provide the conditions for a world where no one has to ever face any health challenges. Creating resilient societies with cleaner air, access to green spaces, safer sources of energy, as well as a well-connected community. I'm proud to be part of the beautiful health community of young healthcare professionals who believe in their responsibility as the first-line responders to the impacts of climate change on health. Medical students are working with their institutions to integrate climate change in curriculum. Young health practitioners are prescribing nature to improve their patients' well-being when connecting with nature, as well as decarbonizing their healthcare facilities. However, such youth-led bottom-up approaches remain siloed from the top-down negotiation processes because of the little dialogue between the ministers that are in the negotiating rooms and young people who are on the outside. And that is why, as the COP27 presidency in Egypt, we took progressive steps to really transform the integration of young people, as well as centering and ensuring that health and intergenerational equity is far from optional in public and political processes. And this was exemplified by the recognition of the right to a safe, clean, and healthy environment in the COP outcome decision, as well as creating the first of its kind dedicated pavilion for children and youth, and organizing a youth-led climate forum with ministers, negotiators, and chairs of country groups. These instrumental breakthroughs marked a critical turning point for the meaningful engagement of young people in the highest level of political decision-making. Similarly, the WHO Youth Council was exceptionally established to reflect the voices of young healthcare professionals who made climate change one of its main working group priorities, as well as the Young Health Working Group, who mobilized thousands of young healthcare professionals in the NFCCC processes. As we explore today the ways to strengthen the role of the health community, I would like to make two specific asks. First, decisions around climate change and health remain siloed, and yet young healthcare professionals have the capacity, the vision, and the capabilities of bringing in a joint vision between climate change and health, translating what we know with what we can do. And that is why my call is at the ministries of health who are present here today, to think about the reorientation of their institutionalized structures, to include young healthcare professionals, not as add-ons, but as natural stakeholders, as key partners that can accelerate action on initiatives such as the Attach, as well as integrated the voices of the most impacted communities at the center. Young people are a diverse constituency with uniquely critical perspectives that should not be marginalized. My second call to action is, as we now take stock of the implementation of the Paris Agreement for the very first time in history at COP28 under UAE's leadership, it is important that health and intergenerational equity is reflected in the outcome. We also have the first ever Health Day, and we want to see the outcomes of the Health Day reflected in the COP outcome decision. And this recognition will play an integral role in ensuring the inclusivity, transparency, and the accountability that young people want to see from their governments so that they are delivering for and with young people. And this entails consulting youth-led organizations and groups in the lead up to COP, as well as understanding their emerging needs, the deep interconnections between climate change and the health of the young people, which can be supported by WHO, the COP28 presidency, as well as the youth climate champion, Her Excellency Shaiman Mazrui. Finally, this event is a testament to our collective will to voice a clear message that the climate crisis is a health crisis. As a young medical doctor myself, I'm here to evoke a feeling of urgency, to address the climate and health emergency and the systemic inequalities my generation is desperately living through. We know that we are entitled to a better future. The science is clear, the solutions are there. So let's work together across silos, across generations, to build the healthy and secure world that young people want and deserve. Thank you.
Thank you. Thank you so much, Amin. Thank you. Thank you very much. We cannot leave the panel without hearing the voice of the private sector. So in that sense, it's really my pleasure to give the floor to Mr. Michel Desmarais, Chair of AstraZeneca. Please, you have the floor.
Thank you, Dr. Neira, and thank you, Dr. Tedros, for inviting indeed the private sector to this panel. It is indeed an honor to be here to share the private sector perspective on the role the health community can and must play in tackling the climate crisis. The health of people, society, and planet are deeply interconnected, as it has been outlined by the esteemed speakers here today. It is an uncomfortable truth that the healthcare sector is such a significant contributor to this crisis, responsible for approximately 5% of global greenhouse gas emissions, around half of which come from supply chains and almost half from the delivery of patient care. But we must face up to this reality and take action to reduce our collective emissions. Decarbonizing healthcare is not a nice to have. It is critical to improving the health of people, society, and the planet. That's why I've been impressed by the way the private sector is stepping up to drive action, both at the individual company level and through truly innovative public-private partnerships. At AstraZeneca, we are committed to walking the talk, through delivering deep decarbonization from the lab to the patient. Through our flagship Ambition Zero Carbon program, we are on track to reduce absolute Scope 1 and 2 emissions by 98% by 2026. We have already achieved a 59% reduction to date. By 2030, we aim to halve our entire value chain footprint on the way to science-based net zero in 2045. In addition to our own efforts, we recognize that the challenge of this magnitude requires collective action, and we must work together to decarbonize the healthcare value chain. This is why we are a proud founding member of the Sustainable Markets Initiative Health System Task Force. Originally convened by King Charles III and chaired by our CEO, Pascal Soriot, the CEO-level public-private partnership, which proudly includes Dr. Tedros, aims to accelerate the transition to net zero health systems. The SMI made bold commitments at COP27, and together we are making concrete progress. For example, recognizing the challenge of Scope 3 emissions, the task force recently launched joint minimum supplier targets to drive decarbonization at scale and streamline asks of suppliers. And we are developing new frameworks and tools to measure the emissions of healthcare delivery. Of course, we know that the best thing we can all do for the good health of people, society, and the environment is to keep people well and out of the clinic. Acting early to prevent, detect, and treat illnesses optimally is critical here, and leveraging the latest digital innovation and technology is key. Together, we can shift the needle and drive system-wide impact. Just as the healthcare sector united in the fight against COVID-19, including through the COVAX initiative, so too must we apply the powers of science and innovation, agility, and true collaboration to this public health crisis to enable populations and our planet to thrive. Thank you.
Thank you. Thank you so much. And I know that we are terribly late, but we still have a long list of speakers here with very important messages to deliver. I think I will ask you a special intervention, very, very short, starting with my colleague, Dr. Marco Jacobs, on the perspective from the Pacific countries. Very short, please.
Thanks very much, Maria. I'll talk very briefly about the part of the world I have the privilege to work in, the Pacific. Pacific Island countries are on the front line of climate change and are among the world's most vulnerable to extreme weather events and the cascade of effects resulting from climate change. Rising sea levels continue to erode low-lying atolls and coastal areas, threatening homes, communities and livelihoods, and health impacts are already being seen. Being on the front line of this fundamentally important issue, not surprisingly, makes tackling the issue a major priority for Pacific countries and for WHO's work with Pacific countries. Despite the challenges, this priority also creates opportunities for effective action in the Pacific. The issue has a high profile and there's general consensus on the need for real action. There's growing support from partners and a subset of Pacific countries, with the help of WHO, have been able to access funding from sources like the GCF and the GEF, although other Pacific countries have so far found such funding difficult to access. And there's already good examples of effective initiatives in the Pacific, which can be learned from and scaled, a couple of which I'll mention very briefly in a moment. When we think about the roles of the health sector in helping to tackle this issue, broadly, it's similar to other parts of the world, of course. But what I'll just mention is when it comes to adaptation, there's 2 comments on adaptation, 2 on mitigation, and then I'll stop. On adaptation, of course, as we've heard, we need to further strengthen country capacity to manage climate-related health impacts. And the one good example of the work in this area in the Pacific is the work on strengthening national emergency medical teams across the Pacific. And with support from Australia, New Zealand, the United States, Japan and the EU, and technical support from WHO, at least 10 Pacific countries now have trained, resourced and functioning EMTs that have already been rapidly mobilised to help manage disasters and epidemics. Secondly, on another area of adaptation is strengthening resilience of health systems, and the one example I wanted to highlight there is the work in Fiji, funded by the Republic of Korea, to conduct climate vulnerability assessments of all of their health facilities in the country. And it means now that that work has been completed, and it means that they now have a list of prioritised health facilities most needing strengthening, or in some cases relocation. On mitigation, the point has already been made about the importance of health sectors and health professionals advocating for climate action. The final point I wanted to make is that the second area of mitigation is the health sector walking the talk on climate. Health cannot be a credible voice on the need for effective climate action without being serious about tackling the sector's own significant carbon footprint and the broader environmental impacts. I'd better leave it there.
Thank you very much. Thank you for giving us that perspective. We need to communicate as well. No applauses anymore. We need to move. We have so many things here. Sorry. We need to communicate, and therefore it's really a great pleasure to give the floor to Gemma Jennings from the BBC. They will tell us what they are doing on a series on climate change and health, the BBC. So please, very quickly. Gemma? Oh, you are there, sorry. We cannot hear you, Gemma.
Everyone is familiar with BBC Studios. We control BBC World News Television and BBC.com. And across those platforms, we have a monthly audience of 500 million viewers. And really, the work of our team is to closely monitor the behaviours, likes and interests of our audiences, and to serve content that corresponds to those interests, really to craft stories that go beyond the headlines to offer a more in-depth consideration of a theme. And of course, the BBC has a long tradition in documentaries about the natural world. I'm sure programmes like Blue Planet, and of course names like our very own Sir David Attenborough are very familiar to everyone in this room. But actually, the series that we are announcing here today, which we're calling The Climate and Us, we wanted to challenge the perception that climate change is happening in some far-off natural world, and we wanted to bring it closer to audiences. And in doing so, engage audiences not just with the health impacts that we've been speaking about today, but with the scalable solutions that are driving meaningful change. And whilst it is perhaps natural to think despairingly, our audience data is sending us a very strong message. We need to make space for constructive storytelling. The tone of this is very clear to us. It is win-win. If we tackle climate change, we can improve our health. And I'd love you all to tune in to some of the stories that we've got planned to ensure that we're framing this right. And so very briefly, there are 3 chapters that we're conceiving of. The first, A Human Crisis, will explore the mitigation of climate change, as well as how we are adapting health systems to become more resilient. So we'll tell stories of decarbonisation solutions in the US, including one with the Environmental Defence Fund on cutting methane emissions. We'll be featuring the link between oceans and human health. We'll examine food security and safety in Ghana. And we'll look at emerging climate tech solutions and the mapping of climate-sensitive diseases that GSK are spearheading with multi-sectoral partners. Our second chapter, which is Greener Healthcare, will examine the vital role the health sector is playing in mitigating its impact, as well as adapting to face this new set of challenges. And here we'll take a look at cross-sector collaboration to accelerate healthcare decarbonisation. And I'm delighted to say that we'll be filming across Europe with partners in this room, including AstraZeneca, for that story. We'll also share stories of NGOs and communities coming together to implement sustainable practices in a segment shot in hospitals in Mexico. And in partnership with Malaria No More, we'll highlight solutions in diagnostics and treatment for vector-borne diseases in Brazil, as well as considering how we are going to continue providing essential services and access after climate-related emergencies like wildfires with direct relief. And finally, the third chapter, which we are calling The Changemakers, will be a set of multimedia stories which will highlight the trailblazers, including younger generations, marginalised communities, healthcare practitioners, and researchers that are driving awareness and action. And we have some brilliant characters who will feature, including those we're working with via Vital Strategies, researching the links between poor air quality and children's health, as well as those prioritising water security in Nigeria. Beyond these segments, we have a few pieces we are developing with the expert health of the Climate and Health Alliance, our wonderful knowledge partner, Jenny Miller, including segments on eco-anxiety and flooding, island communities, and cultural and indigenous eco-management practices. All of those will be confirmed ahead of filming next month and in time for a multi-channel launch slated for October this year, to be followed by a year-long campaign leveraging milestones such as COP28 and World Health Day. So you will be hearing a lot more from us. We would be delighted if everyone in this room, the great climate and health influencers, continue to support our efforts and to amplify the series once live and to give these stories the attention that they deserve. Thank you.
Thank you so much. Amazing project. BBC announcing a big campaign. I have so many important partners, but I think I will start with you, Mr. David Winterai. He's the Director for Global Health of FCDO, a very important partner and with great contributions. Thank you. Over to you, UK. FCDO.
Thank you. Thanks very much. 3 very quick points. One, we really welcome this initiative. WHO have said that climate change is the biggest threat to human health. So as others have said, the climate emergency now is a global health emergency. We're seeing malaria up, air pollution, deaths, so really welcome this push that has been given. 2, the UK is very proud to lean into this agenda following up the COP26 health programme, and as others have mentioned, we co-established a TASH with the WHO to support, and we invite all present to participate on that platform to support the necessary collaboration and to further elevate this issue. And 3, very much support what others have said about the need to take a comprehensive rather than a siloed approach to this. We need to integrate climate change work into our global health work, global health into our climate change work and programs, as well as looking at new initiatives, ideas, and support, and very much support the UAE's Health Day, which will be a pivotal moment, and very much agree that we need action and decisions from that, not just the day itself, and we stand by ready to help. Thank you very much.
Thank you very much, and it was super sharp and short. Excellent. Dr. Tamer Rabi from the World Bank, can you be as short and sharp? I'm sure the World Bank can do that. Come on.
Yes, I'll do my level best. First of all, I'm delighted to be here, and thank you so much for the invitation to provide some few remarks from the World Bank. Climate change, tackling the climate crisis for me is not a job. It's been a passion for so many years, and in the World Bank, I think we've been really committing a lot of our work and resources to actually tackle the climate crisis. I want to start off at the beginning by just pointing out a few important elements that we also need to take into account when we're talking about the climate crisis. We've heard about the burden, obviously the climate-driven burden of disease, but what we've not heard enough about is how much it's actually impacting on people's lives and livelihoods in terms of earnings, perhaps in terms of impacts also on economic impacts as a result of that. And I just wanted to highlight that based on an analyses that we've been doing in the World Bank, the result of climate change is going to be pushing nearly 132 million people into extreme poverty by 2030. Now, out of this figure of 132 million, 44 million is just a result of the health-related impacts from climate change. Also, it's important to mention that the cost of inaction is huge. It's costing governments a large sum of money today, and it will potentially be costing them even more moving into the future. So there's no question in our minds that climate and health and resilience have to be at the center of the dialogue that we're having. But we've also heard that mitigation is a big part of what we need to be able to do. There's, as we know, about 5% of total carbon emissions emerge from the health sector. So this should not be something that we forget in our dialogue. So I want to build a little bit on what we've been hearing. You know, the climate crisis is a health crisis, and also I'd like perhaps to say that if we are investing in health, we're in fact investing in people's resilience. And with that in mind, and following the Paris Agreement, the World Bank in 2016 developed its first climate change action plan that defined a number of core indicators and targets for World Bank financing. And as a result of that, we've committed 35% of the share of World Bank financing across all sectors by fiscal year 2025 to go towards climate adaptation mitigation. This number will be increasing to 70% of the share of financing from the bank by fiscal year 30. And starting July 1st of this year, all World Bank investments that will be approved by the Board of Executive Directors will have to show that they are aligned with the Paris Agreement. We have spent $2.2 billion over the past 5 years in assisting countries with their health investments on climate. And 80% of that has been on adaptation. Now, we're taking a transformative approach as we speak now in really trying to integrate climate within the $44 billion active investment portfolio that we have in health. And this is a huge game changer for us in the World Bank. We're adopting a country-driven model that comes in really to focus on understanding risks and vulnerabilities, adaptive capacities, as well as emissions at a country level, but at the same time also thinking about how we could work with our client countries in supporting them through capacity development, and particularly, obviously, in the case of financing of investments for climate action. So for that, we're looking at needs, we're looking at sources, and we're looking at funding modalities and innovation for financing. I'll end just by saying that a big thank you to the COP28 presidency for bringing in a health day this year, for bringing all of us together to think about solutions and to maximize financing for climate and health.
Thank you very much, Dr. Rabi. Thank you very much. Let me give the floor now to the Rockefeller Foundation. Talking about financing, talking about philanthropy, please. Manisha Binge, you have the floor.
Thank you so much. Thank you all. It's a pleasure to be part of this discussion. As we have all heard today, climate change is, in the word of Dr. Tedros, the single biggest threat facing humanity. As we rise to this challenge, I want to make sure we don't miss some of the key learnings from the pandemic that we just experienced. The first lesson that I want us to acknowledge is that the pandemic, the haste to limit COVID-19 spread resulted in unprecedented global inequities. In the global climate negotiations, we must recommit to centering the voices of those most affected, especially the low and middle income countries who contribute the least to climate change. The second, and this is an opportunity, the response to the pandemic resulted in an acceleration of science and evidence and an unprecedented collaboration across sectors. There's a need to harness that cross-sectoral collaboration to address the impact of climate on health, starting with building on a robust foundation of evidence. And we know we have it. Let's not reinvent the wheel. Let's start with what we know works. Lastly, we learned that good information, trusted, timely, and accurate, saves lives. We harnessed the digital revolution like never before. And that stress test opened the door for remarkable innovations in transparent and collaborative disease surveillance. We need to apply that challenge ahead of us. We need to modernize and expand our information platform, include a diversity of factors, public health, weather, mobility, and vulnerability. And that, again, brings sectors.
Thank you so much. I'm really sorry. They are telling us that we need to leave the room, but I have two short intervention. Norway, please, you are such an incredible supporter. Can you say a few words?
Okay, thank you. I was asked to focus on nutrition, and as you all know, what we eat affects both our health and the climate. So the Nordic Council collaboration has, among other initiatives, resulted in 5 editions of the Nordic Nutrition Recommendation during the last 40 years. And on June the 20th, we will launch the new edition of the Nordic Nutrition Recommendation, the result of 5 years of work involving 400 researchers and experts. In addition to include an update on recommendation for energy and nutrients, the Nordic Nutrition Recommendation has developed evidence-based platforms for national food-based dietary guidelines, as well as the integration of overweight and obesity. And new of this year, environmental aspects are added into the food-based dietary guidelines. For the first time, the Nordic will in this way present scientific advice, not only about which diet is good for your health, but also what is good for the environment. And I'll stop there.
Thank you so much, Secretary General of Health from the Norway. Thank you so much, and I appreciate your flexibility. Last. Just Carling and healthcare without harm. You have 30 seconds. You have to be very passionate.
Okay, Excellencies.
And then we have Kuwait as well.
Political momentum for healthcare decarbonization and resilience is growing. We've heard today about the 66 health ministries that have joined ATTACH. In addition, the G7 has also endorsed healthcare resilience and decarbonization as a priority, and the G20 under India's leadership this year is poised to do the same. The political will is there and increasing, and it's now time to turn ambition into action. Yet, no matter how much action we take within our own sector, the climate crisis will inevitably overwhelm health gains the world has made in recent decades if we don't practice primary prevention and address the root causes of the crisis. The exploration, production, and combustion of fossil fuels is the primary driver of climate change. Air pollution from fossil fuel combustion already kills more than 7 million people a year. The growing climate crisis will add millions more to the annual toll. As Dr. Tedros has said, we need to kick our addiction to fossil fuels. If we're to protect public health from climate change, the health sector must become a leading voice for a rapid, just, and healthy transition away from fossil fuels and toward accessible, affordable, clean, renewable, healthy energy. This is the transformation that will also bring massive health co-benefits.
Thank you so much for being passionate and short. Last, dear Minister, over to you. Kuwait.
Thank you, Maria. It's my pleasure to announce the commitment of the state of Kuwait to develop its national health system to be resilient to the impacts of climate change. Kuwait is currently advancing on conducting a climate change and health vulnerability and adaptation assessment and the development of a health national adaptation plan. Kuwait will also join the Alliance for Transformative Action on Climate and Health, ATTACH. This is considered one of the Kuwait's steps in taking an active part in climate action and an expression of its concern regarding the health of people in Kuwait. This is also a remarkable step in the development of our national health system to face any future crisis. Such a commitment taken by the countries will help reduce risks related to climate change. This is not one country's battle, and we are open to share experiences and collaborate with other countries to be part of the global community efforts to strengthen healthcare systems and protect lives. We welcome the announcement of the COP28 Health Day and the Climate and Health Ministerial Meeting. And we look forward to collaborating with United Arab Emirates within the Gulf region in this global initiative to strengthen health resilience to climate change. Thank you.
Thank you so much. And welcome, for those of you counting the number of countries endorsing attached, 67. Thank you so much, Kuwait. Thank you. And I think that was a wonderful way to close this session. Apologies for being so late, but this demonstrates how everybody was very much interested, and we thank you so much for your participation. We cannot even have closing remarks or anything because we are super late. Thank you, thank you, thank you, and green in the health sector.
It was fantastic.
A little bit hectic, but
see you in
Mamma Mia.
Dubai, United Arab Emirates.
Of course, count on me.
You're hectic.